Hi, I'm Dr. Catherine Robson. I'm a clinical psychologist in Hampshire CAMHS, and the talk today is a brief introduction to autism and the process of assessment. A brief introduction to autism, and it is very brief, so we can only touch on elements of what you will need to know. But if there is one thing that you take away from today's talk, is that I want to direct you towards the people who really know. So Autism Hampshire, the National Autistic Society, Hampshire and Isle of Wight Support for Neurodiverse Families, and also Hampshire Parent Carer Network. The links are there for the websites. Please go and visit them for lots more in-depth information. And I'll refer back to them a bit later on as well. So what is autistic spectrum disorder? In Hampshire CAMHS, we use the DSM-5 criteria for assessing and diagnosing autism. In this criteria, it uses the terminology autistic spectrum disorder, or ASD. Now, we're aware that autistic people really not very fond of this, don't like it, because it talks about disorder. So you will find in reports that reference the criteria that we might talk about disorder, but otherwise we try to talk about autistic spectrum condition or just plain autism. And they are all the same things. We're referring to the same thing. Within that, just another note, we also know that generally speaking, autistic people prefer to be called autistic people rather than people with autism, but this really does vary according to the individual. So a real key thing to know is please ask the person themselves what their preference is. Okay, so let's talk about the criteria. So within the DSM-5 criteria, there are two separate sections. And the first section is about social communication differences in autism. And we've got differences in emotional reciprocity, understanding, forming, maintaining relationships, and non-verbal communication. So I'll talk a little bit about those now, but then we'll talk a little bit about what you might actually experience in those. So emotional reciprocity is the ability of the person to engage in social interactions between two or more people, to be aware of the emotional and interpersonal cues of others, and to play an equal role in that interaction, in that turn-taking, in that flexibility, and about understanding the social cues and the emotions and the needs and the motivations of other people. Understanding, forming and maintaining relationships is about all kinds of relationships. It's about understanding what different relationships are, the difference between a friend or a teacher or a doctor or just an acquaintance or the shopkeeper, and how you make those relationships and how you act within them. And then we've got non-verbal communication, which is about facial expressions, gestures, behaviours, and how those are used and understood. So that's the first section of the diagnostic criteria, and to get a diagnosis of autism, an autistic person will show differences in all of those three areas. The second section of the diagnostic criteria talks about repetitive and restrictive interests. And what that is thinking about differences in movements and speech, differences in routine and managing change, and perhaps difficulties within that. It talks about restricted interests and obsessions, but that might be intense or unusual interests, and then also sensory needs. And the diagnostic criteria talk about needing two out of those four to reach a diagnosis of autism. So within those criteria, another element of the diagnostic criteria is that these differences are shown within the early developmental period, and that they have an effect on the young person or the adult in their lives. Now, it used to be the case in the previous editions of the diagnostic manuals that it said it had to be present before the age of 3. They've taken that out now to allow for the fact that some of these differences don't become evident as difficulties or impairing or difficult in life until later on when demands outweigh the child's abilities. But what we are thinking about is that these differences are present from a very, very early age in the child, even though they might not be problems. And that's really important to bear in mind. Okay, so let's have a little think about what you might see, or also what the young person themselves might experience that might give us a sense that we might consider autism. So we might see, or we might understand that there are difficulties or differences in how the young person understands the social context. We live in a world that is completely governed by social situations and social rules. But very rarely are we told what those social rules are. When you go in to see a presentation, maybe like this, there's not a big sign on the door that tells you this is the rules in this situation. Please sit down nicely, please look ahead, please try and look interested. We just kind of know, we've grown up, we've understood that that is the rules of those social situations. Autistic people might struggle to understand those things in a natural way, to know what to do in any given situation, whereas it feels like it comes naturally to other people. I saw a young person with autism, an autistic young person, describe this as feeling like being thrust on a stage where everybody else knew the script and they didn't. So what you might see is that actually autistic people might become overwhelmed by social demands. They might not understand social rules. They might become very anxious in social situations because they know they don't understand. Or they might get it wrong sometimes. They might appear rude, blunt. And that can be a difficulty when people don't understand where it's coming from. What else might you see? You might see differences or unusual ways of talking or communicating. That could include that emotional reciprocity bit of difficulty listening or taking turns or having conversations with a to and fro element. But it might also be differences in the use of non-verbal communication, for example, gesture, facial expressions. What we often hear described is that autistic people sometimes don't show their emotions on their face so much. Doesn't mean they don't feel the emotions, but it's not so obvious for other people to be able to read them. Or there might be differences in the way they use or understand other people's facial expressions or behaviours or gestures. Sometimes it can be that they communicate in a very specific way, maybe their tone of voice, maybe the way they use their intonation. Sometimes it can also be the way that they present themselves or their information, and sometimes we talk about people seeming old for their age or talking in a very grown-up way, for example. But sometimes it's things like talking in accents when they don't have an accent. What else might you see? So friendships, it's that developing relationship bit. So autistic children can struggle or have difficulties in making and then keeping and also just understanding relationships. And that can be friendships or it can be other types of relationships as well. Sometimes we don't see this as being a problem until the relationships change. For example, I often hear about children who at primary school have a lot of friends, maybe not particularly one friend or a small group of friends, but they're very popular. And sometimes that's because they're very good at certain things. They're very funny, or they're really good at sports, or they're really brilliant in the playground at football. And so when children are young, it's not a problem. They're just interacting with lots of different people. But when those friendships change a little bit and perhaps become more based on talking or understanding other people a bit more, then that's when the problems sometimes become a little bit more evident, or the differences. Other things that you might see are differences or difficulties in understanding what other people mean and what other people's motivations are. So that's about understanding and thinking about how others think and feel. And to do that, you have to really appreciate that somebody else is very different from you, that they have different experiences, different thoughts, different beliefs, and therefore, when they say things or when they communicate, it might not be what you would do. And that's all pretty complex. And that can be difficult for young people with autism, autistic young people. I worked with a young woman who told me that because of her autism, she actually had to work very, very hard to do these things. She could do them, but when she was interacting with other people, what she did was she looked at their face and she thought, what are their facial expressions telling me? And she listened to their tone of voice and she thought, what does that mean? And she thought about the words that they were saying and the situation that they were in. And she tried to make sense of all of those things together to work out what the person was meaning and therefore what she should respond with. And she did it really, really well. But the important thing to understand here is that she did it all really consciously. She worked it out and she analysed it. And she was brilliantly able to describe that. But it was very effortful and it was exhausting for her. So sometimes those difficulties can be quite internal to the person and we don't see them so much. But it can be very, very hard for an autistic young person. Okay, what else might we see? So often autistic people can struggle with understanding and communicating about their own emotions. It's not that they don't have emotions, but there can be a difficulty in understanding the internal experience of it, but also difficulty in putting words to that so that other people can understand. And in my work with autistic young people, sometimes what I find is that they'll often just talk about feeling bad. And it's quite hard to pull apart the subtleties of that. There is a condition called alexithymia, which is quite common in autistic young people, also people without autism, but that is about understanding your own emotions and being able to communicate them. Another thing that can be a difficulty is imagination. Now, I'm not talking necessarily about the ability to make up stories, to be creative, to be artistic, because actually, as we know, many, many autistic people are amazingly creative, artistic, can write incredible stories, can describe incredible situations. But there is an element of imagination that is involved with thinking about things that haven't happened and being able to predict what is going to happen. So to be able to think about the future, for example, I have to be able to imagine something that hasn't happened yet. And that can be really difficult for a young person who is autistic. And if you can't imagine or you struggle to imagine something that hasn't happened yet, then you struggle to think about the future. You can have difficulty generalising. And you can have trouble thinking about what the options are and therefore what to do. And in that situation, the future, or things that you don't know or you haven't experienced yet, can become really anxiety-provoking and scary. Another thing that you might see is a strong or perhaps slightly unusual interest. So it's one of the key features that we see and we look for. And that can be a really strong interest, passion in something, but that thing can be a very usual type of thing. It could be football, it could be makeup, it could be the latest pop group. But the key thing about this is that the interest is followed really, really strongly. It takes over. It gets in the way of other things, perhaps. Often a key feature about it is the amount of information that's gathered and known about it, and the element of doing it on your own, not so much as a social interest. So, for example, people who are interested in football may be really passionately interested in football, follow their team, but possibly one of the things they like about it is talking about their team with other people who like it as well. They like going to the matches with their friends. They like having the conversations about what do you think will happen next season. But what might be a little bit different for an autistic young person might be the interest in facts, figures, information, and less focus on that social side of the interest. What you also might see is actually an unusual interest. So something that actually is a very specific interest that might not be very common for young people their age. So we often talk about really strong interest in trains, and that is actually quite common in autistic young people. But I've also seen other particular unusual interests in particular makes of cars, very specifically. What else might you see? You might see fixed routines or particular ways of doing things. And that might be always having to go to the supermarket by the same route on the road and there being a difficulty if for some reason you do something different. It might be always having to keep the same routine of a day. So if you finish school and you're expecting to go home, that's what you expect to do. And if your parent says, we just need to pop to the shops, that might cause a problem. And another really strong thing that you might see are sensory interests or sensitivities. These didn't used to be part of the DSM-5 criteria, and they've been brought in because they're so common. So this can be particular preferences for particular sensory things, liking the feel of things or needing to touch something. But they can also be, and often is, sensitivities. So difficulty with too much noise or particular noises, or with busy, crowded environments, or with the lights or the sounds or the temperature in a room. And that can cause a lot of problems. So that's what you might see or how people might experience being autism, just a brief look through. But there's lots of things that can look like this that isn't autism. So for example, there's quite a strong overlap between autism and ADHD, but they are two different neurodevelopmental conditions. So ADHD, or attention deficit hyperactivity disorder, can share quite a lot of similar issues. For example, you sometimes see in children with ADHD that they have difficulty making friends or with their friendships. But when you stop and think about why that is, it's quite different from why a child with autism might have difficulty. So for example, a child with autism, an autistic child, might have difficulty making friendships because of understanding how friendships work, being able to be flexible within those friendships, being able to adjust to what the other person needs, or understanding what the other person means when they say or do something. A child with ADHD might also have difficulty making friendships, but that might be because they're impulsive and they say things that annoy other people. Or they're too busy paying attention to something else or being distracted that they don't listen to the other child, and therefore it's difficult to form those relationships. So it can look like the same thing, but the reasons are different. And that's the same for quite a lot of other conditions as well. For example, anxiety disorders. So children with autism, autistic children can be very anxious, but also anxiety disorders, being worried about saying and doing the wrong thing, can sometimes look a little bit like autism. Other things that you might think about are sensory processing disorders, perhaps specific learning difficulties, So a difficulty in a class with processing information. Response to trauma can overlap, or can look like it overlaps quite a lot with autism. So the need to have things in a particular way, a difficulty sometimes with interacting with others in particular ways. Also, mood difficulties. For example, low mood. If you're really low in mood, it's difficult to form relationships with other people. Your social interactions are not how they would be otherwise. So there's lots of other things that overlap or can present similarly, but are not autism. So the really important thing to do is to look at what that child is presenting with, their needs, listen to what the child is saying and work with what you see, and to work alongside parents, professionals and other people involved to be able to support that child with whatever their needs are. Why might an assessment and a potential diagnosis of autism be useful? So what we find is it can be really useful to help other people particularly become aware of the person's needs and their behaviours, and to consider what adaptations might be useful around the child or the young person. And that is a particular strength of having a diagnosis, to allow other people to understand how they might need to change things or do things differently. A diagnosis might also support the young person to understand themselves better and to accept themselves. When we work with autistic young people, we often hear them talk about feeling bad about themselves, feeling that they're always getting it wrong, feeling like they're a round peg in a square hole, feeling like they're weird or different. And to have an understanding that they're not weird and different, they are autistic, but many other people are autistic, and a lot of strengths come with that as well, can be really important for the young person to begin to accept themselves. It can also provide relief and confidence as a parent and as people around you, and for the person themselves to begin to appreciate their strengths and their own self-identity and to embrace that. And we do know that it can be useful to access appropriate support for parents and the young person. Why might a diagnosis not be useful? So in some cases, a child or young person can really struggle to accept a diagnosis of autism. They might not feel that it fits for them, or they might feel that this label overshadows other elements of themselves as a person. And sometimes that can cause a lot of difficulties. It's also important to know that there are some specific situations where having a diagnosis of autism might be a challenge. So, for example, military careers or working in the armed forces are often harder to obtain due to the setup of the role. And what we do know is that having an autism diagnosis can be a barrier to joining the military. So if that is something that is part of what your child wants to do in the future, where they see themselves, then you need to think really carefully about the process of assessment and diagnosis. We also know that in the past there have been reported difficulties of people applying for visas to other countries, particularly Australia or New Zealand, where having a diagnosis of autism has made it hard to obtain a visa. So again, if that's something that you see in your or your child's future, that's worth thinking about and making sure you do some really clear research about. It's also important to know that as much as the world is changing and everybody is doing their best to be more embracing of difference and neurodiversity, your child or someone with autism, an autistic person, might experience discrimination, either indirect or direct. Legally, this shouldn't happen, of course, but sometimes it does. Mythbusters. There's a common perception that you need a diagnosis of autism to be able to get certain elements of support. For example, an education and healthcare plan, an EHCP. To be really clear, You do not need a diagnosis of autism to have an EHCP. An EHCP should be based on the needs that you are presenting with. Conversely, just because you have a diagnosis of autism doesn't necessarily mean you need an EHCP. There's a myth also that if you have a diagnosis of autism, somehow, suddenly, there will be a treatment. Something will happen. There's no treatment for autism. We don't want to treat autism. We want to help autistic people be happy and embrace who they are, and for people around them to do the same. There is no treatment for autism, and there is nothing that is magically going to change from the 5 minutes before you have the diagnosis to the 5 minutes after you have the diagnosis. Your child is still the same. The child is still the same. They have their same needs, their same strengths, their same personal characteristics. And it really is important that people understand those to change the world around that child. Another thing that we commonly think about is whether people look autistic or not. You can't tell someone's autistic just by looking at them. And sometimes it's really important to understand what's going on inside someone's head in their own internal experience before you can really decide whether they are autistic or not. I talked about the young person earlier who spent a lot of time working out how to be in social situations. And when she was at school, she talked about masking. And that's a common concept. So for some people, through a lot of effort, they can get by in social situations so that other people might not understand there's a difficulty. But the difficulty is in the effort and the ability to naturally feel like you're doing the things that people who maybe aren't autistic do a little bit more naturally. Another myth is the thought of they're autistic, they need mental health support to make things easier. Now, it is true that autistic people do have a higher rate of mental health problems because it is hard to be autistic and live in a world that is not designed for autistic people. It's not set up in the way that autistic people might want to set it up themselves. And that can cause challenges and anxieties. But autism itself is not a mental health disorder. If we can get things right around that person in the right environment, with people doing the right things, and have a good understanding of what that person needs, what we would hope is that child or that young person does not need mental health support. When we think about autism assessment and diagnosis, we tend to focus on the things that are different and therefore cause difficulty for the young person because they are not the same as 98% of the way that the rest of the world does things. But it's really, really important to think about the strengths of the young person with autism. And autism comes along with a lot of strengths. These will be different for every child, of course, but some things that you might notice that are real strengths in autistic people are, for example, the ability to give really close attention to detail, to be analytic, to be thorough. What you might see is, I talked about creativity. Lots of artists and storytellers are autistic. Particular expertise, that intense interest, that passion for particular areas of life can give rise to amazing expertise, and that's often what carries people forward into amazing careers. Other things you might see are the ability to think critically, to be determined, to be tenacious. And we often see a real sense of social justice, a campaigning passion. And again, that's often what changes the world, actually, when people follow those interests. So it's really important that we make sure that we focus on the strengths and not just the things that cause difficulties. Because we should be aiming for all autistic children and adults to be happy and proud of who they are. The aim is never to change the person. The aim is to help that person be proud of who they are, to understand their own needs, maybe to help them communicate those needs and to change the world around them so that they are best supported. A quick note about reasonable adjustments. It's important to know that all services, all professionals, all employers have a duty to implement reasonable adjustments under the Autism Act, the Equality Act, the Education Act. This is important so that autistic people are not at a disadvantage compared to everyone else. But it can be a challenge because autism is a hidden disability, and so this duty is often not fulfilled. I'm going to talk a little bit about routes to assessment because that's often what people want to know about. Now, this has changed very recently in Hampshire. So since April 2024, most new autism assessment requests will go to a service called the OWL Centre, which is a separately commissioned service across Hampshire and the Isle of Wight. Referrals to the OWL Centre can be made by Health, Education and Social Care, and there is a website that has all the details and the links to the referral forms. Before April 2024, some autism assessments went to a service called CICON, and some were held in Hampshire CAMHS. Assessment for very young children may have been seen by paediatricians. So there's different routes has been different routes to assessment, but mostly from now, new requests will go to the OWL service. It's important to know whatever service is providing the assessment, that waiting times to begin the assessment are really long, and that's unfortunate, and no one wants it to be that way, but it's true. So it's important to know that waiting times can be up to 36 months, sometimes more. So the important thing about that is that it's really crucial that we don't wait for assessment or diagnosis to start to address the needs of the young person. So, if your child has mental health difficulties, is showing significant distress in different contexts, is showing harmful, risky behaviours, please seek support through Hampshire CAMHS. You can look at the website for further information or make a referral through our single point of access. But other sources of support that are open to you, you can find out lots of information about autism through the National Autistic Society and Autism Hampshire websites. They both have incredible websites that are full of information about how to understand autism, how to support people who are autistic, and what services and resources are available to you. You can talk to autism advisors through Autism Hampshire, and the contact details are on their website. You can go to parent and carer workshops that are run by Autism Hampshire. Your child doesn't need to have a diagnosis to attend these, and these are provided by Autism Hampshire for any parent or carer whose child is anywhere along the assessment pathway. There are also specialist parenting courses available through Hampshire and Isle of Wight Support for Neurodiverse Families, and these are very specifically targeted at parenting a child who is autistic. Another thing we would thoroughly recommend to do is to connect with other families and parents who have autistic children. Hampshire Parent Carer Network provide lots of opportunities to do this, and we often hear that that is one of the most important sources of support that people find. So please don't wait to seek this support until your child has an assessment. Think about what issues you're wanting to consider, what might be difficult for the child, and find the support now through these sources. I'll talk a little bit about elements of the assessment if you get that far. So all autism assessments should include a full developmental history with the parents, which will think about factors involved in pregnancy, birth, and early months and years, as well as a specific focused conversation about autism features from early childhood up to current time. An autism assessment should also include gathering information from school and other settings. An autism assessment should also include a direct observation of the young person, and this is often through a particular structured assessment called an ADOS. An autism assessment should also include information from other professionals who know your child. And depending on the information that comes back, there may be other elements that are specific to your child and the particular issues. What happens to that information? Well, it is reviewed by a multidisciplinary team, and there's consideration given to the full history, the experiences of the young person in the family, any mental health issues, any learning needs, and any other influencing factors. Putting all the information together, a conclusion is then come to about whether that child meets diagnostic criteria for an autism diagnosis. If a diagnosis is given within Hampshire CAMHS for the children who are on our wait list, then Autism Hampshire then provide post-diagnostic support to help understand what that diagnosis means. Let's spend a little bit of time thinking about how to help now. So, when we think about what can we do to support autistic young people, we often need to ask the question, why is the person doing what they're doing, showing the behaviour that they're showing, or why might there be difficulties that we want to think about? And it's really important to consider the environment that the autistic child is in. And I don't just mean the physical environment, the buildings, although that does come into it, but also the social environment, the communication environment, and the sensory environment. Because that is what will make things easy, difficult, supportive, or challenging. So, thinking a little bit about communication. So what can you do to help communication be clear for a young person who's autistic? So, be clear and unambiguous. Say what you mean and mean what you say. It's really surprising how very often when we talk, we require the other person to interpret what we mean. And that's often when we say things like, oh, it's raining cats and dogs, when we use idioms. Another really important thing to do is to provide information both verbally and visually. I often get people saying to me, my child is really bright. They understand exactly what I'm saying. They don't need me to do that. However, using handouts, writing, diagrams, pictures can be really, really helpful for young people to be able to process information and support their understanding, however bright the child is. Again, also important to allow time for processing. Use short phrases, one instruction at a time. If you want somebody to understand something very clearly, say it clearly and directly. We're really good in this country, I think, at being very friendly and sometimes a bit fluffy in how we speak. Excuse me, would it be okay if you don't mind, if it's really not too much bother, could you possibly just move your chair and that would be great for me and I'd be very grateful, thank you very much. All of that language feels very polite to us, but it can be really hard for an autistic person to understand, where the message is, please can you move your chair? Another really important thing to do is make sure that the words that you are using match your tone of voice, your facial expression, and your gesture. These are all ways that people try to make sense of what is being meant. So if you are using them and they conflict, oh, please don't do that, I really don't like it, then it's very hard for the young person to understand what it is you're meaning. Another really important thing to do which also feeds into a lot of the other areas, is to provide clear and consistent rules and boundaries about situations, what you would like the young person to do, what you expect of them, what they can expect, and how they are going to follow these rules and boundaries. Young people with autism often work really well with clear rules. In this situation, this thing happens. If you have a problem with this, do that. Because it means they don't have to interpret, they don't have to think through all the possible scenarios, they don't have to work out what the right thing to do in that situation is. So that can be really, really helpful. And another thing to think about is using concrete props, for example, books, factual information. And autistic people often work really well with facts and science. I worked with a young person on their anxiety, and I was trying to explain the concept of anxiety and how it worked. And he said to me, "Please could you find me the paper, the scientific research paper that explains this to me?" And that wasn't because he was trying to challenge me, he didn't believe what I said, but to have it written down, to know the facts, to know the science, was how he was going to make best use of that information. And so I found him one. Another really important thing to do for young people with autism is to increase predictability and routine. Remember that difficulty with imagination, with predicting things, can make the world quite scary, quite anxiety-provoking. So use visual timetables and use them as appropriate to the age and the ability of the child. So that can look like a step-by-step account of what to do in what situation. For example, when you come in the classroom, take off your coat, hang it on the peg, put your lunch bag in the locker. Or it can look like a diary, a calendar, a wall chart, to help that young person understand what's happening in the day. Again, it's another of those scenarios where people say that my child knows what to do. But making it concrete, making it visual, making it structured helps that child know what to expect. It also means that if something changes, you can change it on your visual timetable or calendar or whatever you have. And again, that helps the child know when something's changed, when something's different, what's going to happen instead. Another good thing to do is to use predictable daily routines to add security and containment. So, for example, thinking about when you come home from school, always having the same routine. You come home, you take off your shoes, you feed the hamster, you have a snack, you watch TV for half an hour, for example. These little routines can really add structure and keep that child at a level of security where perhaps they're better able to cope with other things that change. Another important thing to think about is if you live in a two-household family, for example, where things might be quite different in the different households. So it can be really important to make those differences clear. In this house we do this, but in this house we don't. But also to think about what are the little routines that you can perhaps keep the same. In terms of thinking about planning for changes, it's really important to plan and prepare. So for new situations, for things that are changing, for things that the child isn't comfortable with or hasn't experienced, talk about them, visit the place in advance, look at pictures and plan coping strategies. And also plan for changes. A really good thing to happen is to have daily check-ins at school, and this can be really helpful for young people, particularly in secondary school, so that they can be prepared for things that are different. For example, you've got maths this morning, Mrs. Jones is off sick, you've got Mr. Smith instead. You know Mr. Smith because he normally takes you for PE. And often, for the young person, it's not the change that's difficult, it's the being unprepared for the change, and this can really help. Another really useful thing to do is to use timers and countdowns to add structure, to add predictability, but also to help that shift of focus from one thing to the next, which can be really difficult for autistic people. So, if it's dinner in half an hour, you might want to give a half-hour warning. It's dinner in half an hour. It's dinner in 20 minutes, dinner in 10 minutes, 5 minutes, 2 minutes. Turn off your computer, it's time for dinner. So that you have a countdown so that the child knows what to expect. In terms of increasing predictability and routine, have a real think about unstructured time. So this can be obvious. So things like when you're having to wait for appointments, if you're going to the doctor, if you're coming to CAMHS, for example, what are you going to do while waiting? Because that waiting time is difficult. But there are other really clear times in young people's lives that are unstructured that can cause a lot of difficulties. And I'm thinking particularly about during school times, about break times and lunch times. Now, we often think about those as having a nice break from lessons, having a chance to socialise with your friends. But actually, for an autistic child, these can be the most difficult times. What do you do in those situations? What are you supposed to do? Who are you supposed to talk to? How are you supposed to talk to them? Sometimes we see that becoming a particular problem in secondary school. It's often much easier in primary school when the rules of playtimes are often much more straightforward. You go outside, you run around for 15 minutes, you come back inside. As children get older, as they go through secondary school, as they become teenagers, those break times become much more social. And sometimes that can be an autistic child's worst nightmare. So think about those times, plan for them, and plan with the young person what they're going to do in those times. And involve them in making those plans. Just a few visual examples I wanted to show of what visual timetables or planning and supporting predictability might look like. And we've got some examples of some quite basic visual timetables, but also something perhaps for an older child or young person or for an entire family can look like a family weekly reminder. So, moving on to think a little bit about sensory issues. We've already talked about that autistic children tend to experience sensory information quite differently, and some unusual behaviours that they show can be linked to children trying to manage their sensory sensitivities. So it's really important to notice what's happening in the environment, to think about the noise that's going on, what the lighting is like, the crowds, the space. Some children may need more or less stimulation to help them function at their best. Things that you need to consider are sights, sounds, smell, taste, touch, but also internal senses, the sense of the body in the room, and also sense of being balanced. And there's different things that can be used to help depending on what is difficult for your child. Although some children can explain the sensory things that they find difficult, what we often find is that actually children just experience a sense of overwhelm. They may become irritable, they may become anxious, they may want to escape the situation, they may have a meltdown. And so it's important to think about what that sensory experience for the young person is who might not be able to explain what's going on for them. Think about things that can help. For example, movement breaks. Whether they like things that can help, like deep pressure, chewing things, particular fiddle toys, particular things that they can touch and feel, soothing activities. But also think about how can that child communicate or recognise when they are having a difficulty and what they might be able to do themselves to cope in those situations. Another area to really think about in helping your child is to think about supporting social understanding and inclusion. We've talked about social situations and contexts being really hard. So your child might need help to understand the rules of social situations and it can be really helpful to make them explicit, just like I was talking about earlier. They might need help to understand their own emotions, so emotional literacy programs can really help. Using a scaling system, for example, like the incredible 5-point scale, to help start those conversations and help that recognition of, this is what it feels like when I'm okay, this is how I begin to notice when I'm not okay, and this is when I'm reaching melting point, so that they can then put their own strategies in. Another thing to really think about is to help that child seek supportive, structured social spaces. I've talked about break times perhaps being difficult, but what about lunchtime clubs? What can that child do at lunchtime? Do they go to the library? Would they enjoy the environment club, where there is a structure, where it is not just about talking about social things? And it can be really important as well to help support and nurture that child's strengths and interests, and to find jobs and tasks for them that highlight these to others. I mentioned before that being autistic in a non-autistic world can be a really hard place to be. You spend a lot of your time thinking, I'm getting it wrong, I'm not doing it right. So it can be really important to build on their strengths so that they know what they do well and what their strengths are, and other people know that too. Another thing to consider is to think about allowing space for a social break. Remember, it can be really, really effortful for young people to be in a social situation at school to get through the day. And actually, they might really work well with having the facility to take 10 minutes out so that they can be on their own. Another thing I just want to talk about when we're talking about social understanding is it can be really important to have explicit conversations about healthy and unhealthy relationships. We know that because autistic people can struggle to understand the motivations of other people or what other people think and feel, that they can be vulnerable in relationships. So have those conversations, think about the rules, and structure and scaffold their understanding of what relationships might be about. So up to this point, I've mostly talked about what people do around the young person, and that's really, really key about how we understand the difficulties and therefore what we do around the young person to support them. What we also want to consider is how we build that young person's own coping strategies and their resilience. So to consider their own skills and a toolbox for that. And within that, we'd like to think about physical strategies, for example, exercise, sensory activities. We'd want to build into their day relaxation. So to do both when things are difficult, but also at structured points throughout the day to keep their stress levels down. We also might want to help them understand social contexts and where they might find social things difficult so that they can use social strategies to help them in particular anxiety-provoking situations. We might want to help them build on their communication skills so they can practice for situations that are difficult, so that they can have a system ready for them if they become stuck in certain situations. But also to help them communicate to other people how they experience the world, what they mean and what they need. We might want to support skills in thinking, to support flexibility, to think about different options, and we might want to help them have their own sensory toolbox for soothing activities to help them when things are difficult. That's just a real whistle-stop tour of some elements of autism. Now, I often get asked about how we use all of this information to help parents, the young person, and the people around the young person, which is often school, understand and work with the difficulties. So I'd like to direct you to this particular bit of guidance. It's called Working Together with Your Child's School, developed by the Autism Education Trust and the Department of Education, which gives a really useful structure to help think about all these various areas for your child and how they might be supported. I'm going to end this talk in exactly the same way that I started, which is that if you take nothing away from this talk at all, the one thing I would like you to take away is the information about other services and supports that can help. The National Autistic Society, Autism Hampshire, Hampshire and Isle of Wight Support for Neurodiverse Families, and Hampshire Parent Carer Network. For more information, please visit our Hampshire CAMHS website.